So let's have a look at antidepressant medication. We now return to the serotonin story begun a few pages back. If low levels of serotonin cause depression, then it follows that depression might be avoided if we increase levels of serotonin. On page 224, we looked at various suggestions to raise serotonin levels, like exercise and eating certain foods. And you know, people who are in a depressive state will often say that one of the ways to overcome it is to exercise, that you might feel awful afterwards, but an hour or so later you're feeling fantastic because of it. The most common method used to increase serotonin is drug therapies, and the most commonly used antidepressant medication is selective serotonin reuptake inhibitor, okay, or known as an SSRI. Okay, the clue is there in what it's called. So SSRI, that may sound like a mouthful, but it is worth remembering it in full because the full name describes the action of the drug. The drug selectively targets serotonin at the synapse. The drug inhibits the reuptake of the serotonin molecules. So let's take that a little more slowly. You're much better at science than I am, so you'll understand all of this. Alright, so presynaptic neuron. Serotonin is released by certain neurons in the brain. It is stored at the end of a transmitting neuron in tiny sacs called vesicles. The electrical signal travelling through the neuron causes the vesicles to release the neurotransmitter into the synaptic cleft. The serotonin molecule conveys the signal from the presynaptic neuron to the postsynaptic neuron by locking into a postsynaptic receptor. Okay, remember our picture with the purple synaptic cleft in there. Reuptake. Afterwards, the serotonin molecule is taken back into the presynaptic neuron where it is broken down and reused. However, if the reuptake can be blocked, then you end up with more serotonin in the synaptic cleft because new serotonin is released from the presynaptic neuron and added to what has been held in the synaptic cleft. This blockage happens because the SSRI molecules occupy the reuptake transporter and thus prevent the serotonin molecule entering. Okay, so now we can raise the level of serotonin. So let's just look at the stretch and challenge. The drug Ecstasy works in a manner similar to SSRIs. Ecstasy prevents the serotonin reuptake system carrying serotonin back into the presynaptic neuron, and it also brings serotonin from the terminal into the synaptic cleft. So more serotonin is present in the synaptic cleft and more is added from the presynaptic neuron. In this way, there is a considerable increase of serotonin in the synaptic gap, which means the postsynaptic neuron receives increased stimulation. This explains why ecstasy can lift a person's mood. Alright, so we are not suggesting that you try ecstasy to improve your levels of depression. However, it is a very similar idea, and obviously this is the problem with drugs that are taken by people, is that they don't necessarily know the chemical effects of them. Now, what that would suggest is that controlled levels of ecstasy might actually be helpful for people in a depressive state. Okay, but unfortunately it's become a drug choice connected with raves and youth culture, and therefore the medical use of it has been lost. Yeah. Okay, so if we look to the top right on page 229, it's now talking about Prozac, okay? You may have heard of Prozac. Prozac is a brand name for one type of SSRI called fluoroxetine. There are actually quite a few different types of SRIs, such as, sertraline, one brand name is Lustral, and paroxetine, one brand name is Paxil. The brand name is the name that the drug manufacturers uses when selling their drug. There are also other antidepressants, such as tricyclics, which target serotonin in a similar way to SSRIs. And SNRIs, serotonin noradrenaline reuptake inhibitors, which target both serotonin and adrenaline. Okay, so here we go then. We also know, don't we, that a rush of adrenaline is something that can kind of move somebody forward. So if you're in a depressive state, you're not necessarily going to be getting that uptake of adrenaline. So now you've got these types of SNRIs, which will also include adrenaline to give you the energy to be an impetus to be able to actually get up and do something. All right, so just look at the bottom here. On the study tip, it says don't overdo the biology. So don't get too bogged down in the detail of synaptic transmission when explaining how antidepressants work. Remember, you're describing how antidepressants work rather than the entire process of synaptic transmission. Choose a few select terms in your explanation that show you understand how the drugs work, but no need to go overboard as long as you have enough for an essay on the topic. Not an essay, but a 9-mark answer, okay? They're not actually looking for a scientific explanation, just an awareness that you understand about the transmission and therefore the biological effect that it's going to have on the person if they take an antidepressant. All right, so let's look at the evaluation. Side effects. A negative is one weakness of using antidepressant medication is that such drugs have serious side effects. So the side effects of SSRIs include nausea, insomnia, dizziness, weight loss or gain, anxiety, sweating, to name just a few. The most serious side effect is an increase in suicidal thoughts. People think that taking drugs is a relatively easy solution to their mental health problems. At least it is easier when compared with alternative psychological therapies, which require a lot of effort on the part of the patient, and you'll see that when we look at CBT next. However, even though drugs are an easy solution, they actually may not work because patients stop taking them. Patients dislike the lack of control they may feel over their own behaviour. They report feeling spaced out and numb, like being in a dream. This means that the side effects are a serious threat to the effectiveness of drug therapies. Okay, so not only can it have all of these side effects, you've also got this idea that alongside that, if a person starts to feel they're out of control, they want to have that level in their life where they're actually making the decisions for themselves, right? So, looking at something like One Flew Over the Cuckoo's Nest, you will see that basically the people just become these blobs that are being looked after by the nurses rather than actually being able to control what is going on for themselves. Okay, so there is questionable evidence for effectiveness. Another weakness of antidepressant medication is that the evidence for the effectiveness of such drugs is questionable. One of the mysteries of antidepressant medication is that it takes 3 to 4 months of daily use for SSRIs to have much impact on symptoms. This doesn't make sense if the drug is increasing quantities of serotonin immediately. In fact, research shows that the serotonin levels of depressed people may not actually be that different from the normal population anyway. This suggests that the effectiveness of the drug may not be related to serotonin at all. It may be a placebo effect. When people are given a pill containing nothing of any medical value, they still improve. This is because they believe they are receiving treatment, and such belief alone leads to improvement. In fact, when people are given 2 placebo pills, they improve even more. This supports the notion that the effectiveness of drugs may just be due to belief, not any actual physical effect. All right, so we've talked about placebo effects before, and obviously if you are in a depressive state, it may be that what you need is just that thought that something is actually going to help you. And SSRIs taking 3 to 4 months actually suggests they're not that effective. Either the rate that they're increasing serotonin is not effective enough, or that's not what is actually making the difference. Okay, so this is a reductionist approach. So this is a final weakness of antidepressant medication, okay, that it is regarded as reductionist. So the use of antidepressant medication that targets serotonin and sometimes noradrenaline suggests that neurotransmitters are the only factor that causes depression. In other words, this reduces depression to the action of neurotransmitters alone. This suggests that other treatments are not necessary and may lead us to overlook factors that might be important in the treatment of depression, such as what the patient is feeling about themselves. A more successful treatment might include both biological and psychological approaches, which is a more holistic approach. All right, so we know that there is often a trigger to depression, okay, and if there's that trigger, then that needs to be dealt with as well, not just chemically changing the makeup of a person. Okay, so it's over to you. PowerPoints, I'm going to try and add them to this. And then you need to look at the apply it concept and the check it to make sure that you understand everything. People who experience severe depression are immobilized by it. Their low mood means they have very little motivation to be able to do anything about it. Therefore, the hope offered by a capsule is a lifeline. Drug treatments for mental health problems first appeared in the 1950s and led to a revolution in care for patients. They no longer needed to live in an institution, but could return to the community and take up a relatively normal life. Okay, remember I suggested you watch something like One Flew Over the Cuckoo's Nest, where you can see the way that mental health institutions, I use the word lightly, used to be run. Okay, this idea that a pill could cure everything. The mental hospitals of the past disappeared, along with the many inhumane practices therein, because the people that were in them weren't treated with any regard. The hospitals were overcrowded, unable to offer much in the way of treatment, and patients became institutionalized, unable to leave even if they did get better, because they became used to that way of life. Drug treatments offered a seemingly easy solution, except they too have their drawbacks.